What causes vaginal itching? Vaginal itching is an uncomfortable and sometimes painful symptom that often occurs due to irritating substances, infections, or menopause. It may also occur as a result of certain skin disorders or sexually transmitted diseases, STDs. In rare cases, vaginal itching might develop due to stress or vulvar cancer. Most vaginal itching isn't a cause for concern. However, you should contact your doctor or gynecologist if the itching is severe or if you suspect you have an underlying condition. Your doctor can determine the cause of your vaginal itching through an examination and testing. They'll also be able to recommend appropriate treatments for this uncomfortable symptom. Causes of vaginal itching. Here are some of the possible causes for itchiness of the vagina and the surrounding area. Irritants. Exposing the vagina to irritating chemicals can cause vaginal itching. These irritants may trigger an allergic reaction that creates an itchy rash over various areas of the body, including the vagina. Common chemical irritants include soap, bubble baths, feminine sprays, douches, topical contraceptives, creams, ointments, detergents, fabric softeners, scented toilet paper. If you have diabetes or urinary incontinence, your urine may also cause vaginal irritation and itching. Skin diseases. Some skin diseases, such as eczema and psoriasis, can cause redness and itching in the genital region. Eczema, also known as atopic dermatitis, is a rash that primarily occurs in people with asthma or allergies. The rash is reddish and itchy with a scaly texture. It may spread to the vagina in some women with eczema. Psoriasis is a common skin condition that causes scaly, itchy, red patches to form along the scalp and joints. At times, outbreaks of these symptoms can occur on the vagina as well. Yeast infection. Yeast is a naturally occurring fungus that's normally present in the vagina. It usually doesn't cause problems, but when its growth goes unchecked, an uncomfortable infection can result. This infection is known as a vaginal yeast infection. It's a very common condition, affecting 3 out of 4 women at some point in their lives, according to the Mayo Clinic. The infection often occurs after taking a course of antibiotics, as these types of medications can destroy good bacteria along with the bad bacteria. The good bacteria are needed to keep yeast growth in check. The overgrowth of yeast in the vagina can result in uncomfortable symptoms, including itching, burning, and lumpy discharge. Bacterial vaginosis. Bacterial vaginosis, BV, is another common reason for vaginal itching. Like a vaginal yeast infection, BV is triggered by an imbalance between naturally occurring good and bad bacteria in the vagina. The condition doesn't always cause symptoms. When symptoms do appear, they typically include vaginal itching and an abnormal, foul-smelling discharge. The discharge may be thin and dull gray or white. In some cases, it might also be foamy. Sexually transmitted diseases. Numerous STDs can be transmitted during unprotected sexual intercourse and cause itching in the vagina. These include chlamydia, genital warts, gonorrhea, genital herpes, trichomoniasis. These conditions can also cause additional symptoms, including abnormal growths, green or yellow vaginal discharge, and pain while urinating. Menopause. Women who are going through menopause or who have already done so are more at risk for vaginal itching. This is due to the reduction of estrogen levels that occur during menopause, which leads to vaginal atrophy. This is a thinning of the mucosa that can lead to excessive dryness. The dryness can cause itching and irritation if you don't get treatment for it. Stress. Physical and emotional stress can cause vaginal itching and irritation, though this isn't very common. It might occur when stress weakens your immune system, leaving you more prone to the infections that cause itching. Vulvar cancer. In rare cases, vaginal itching may be a symptom of vulvar cancer. This is a type of cancer that develops in the vulva, which is the external part of the female's genitals. It includes the inner and outer lips of the vagina, the clitoris, and the opening of the vagina. Vulvar cancer may not always cause symptoms. However, when symptoms do occur, they may include itching, abnormal bleeding, or pain in the vulvar area. Vulvar cancer can be treated successfully if your doctor diagnoses it in the early stages. This is another reason that yearly gynecologist checkups are essential.